I'd like to talk to you about something that can blight the career and quality of life of so many nurses, and absolutely unreasonably, unfairly, and unnecessarily. Now, I'm talking to you from the perspective of a mental health nurse, but I'm pretty sure that the same conditions apply in every form of nursing. You see, there are expectations placed upon us by patients, by relatives, even by our employers sometimes, that are entirely unreasonable. People expect, for example, in my specialty in mental health, they expect us to be able, in a matter of weeks sometimes, or even days, to solve a person's psychological problems that may well have taken many years of abuse to develop. And if we can't fix them within some arbitrary time frame, then either the patient or the patient's relatives or somebody else with some ridiculous made-up deadline won't just criticise us, but they'll go public, they'll use social media to tell people how useless either we are or our organisation is. I've known nurses be assaulted for not managing to keep up with impossible deadlines set by people with absolutely no understanding of the task involved. And the upshot of all this, for many of us, is we take it on board. We think if we fail to meet this arbitrary deadline, whatever it is, we are the ones at fault. But you know, it's not my fault if someone else demands that I do the impossible. Look at it this way. Imagine you're walking down the road, it's pension day, and some little old lady has just been to the bank to draw out some of the money that's been electronically deposited for her. She walks out of the bank, she's got a handbag over her arm and a wad of cash in her hand that she's just about to deposit in the bag, when a couple of young lads run down the street. They knock her over, they take the cash, one of them stamps on her head for good measure. You, of course, being a nurse, that's what brought you into the profession, is to try to help people. You immediately rush across and see what you can do. You shout to someone else to call an ambulance, which they duly do, and while that ambulance is coming, this lady, who has suffered a massive head injury and had a weak heart anyway, dies in your arms, bleeding all over your new jeans. Do you feel guilty? Well, maybe you do, but you shouldn't, because you did not cause this. You tried to help, which is more than the vast majority of people on the high street did that day. Most of them either stood and gawped, or crossed over to the other side of the road and immediately darted into the nearest shop to pretend that they hadn't noticed and they weren't there. At least you tried to help to sort out a problem you did not cause. Now that's exactly the same as the situation you have at work. At least you have tried. And assuming that you did all that you were expected to do, within the realms of possibility, then whilst others may criticise you, others may even put you at risk, that does happen occasionally, but you do not have to agree with them. You can still maintain your self-esteem, you can maintain your quality of life, and above all, you can understand that for all of the fine words of people who are criticising your practice, you did more than them. You tried. Never forget that. You have tried. And if you can't do the impossible, well, welcome to the human condition. That's nothing to be ashamed of. My name's Stuart Sorensen. I'm a mental health nurse and trainer. Thank you for listening.